With the discovery of the first antibiotic, penicillin, in 1928 by Alexander Fleming and its introduction into the world of medicine a decade later, the warfare against bacterial infections completely changed. Suddenly, once fatal diseases like pneumonia were curable. By the 1940s, this miracle drug was widely used and easily accessible to the general public. Surely, that would have been the end to the battle against bacterial infections, right? Well, not exactly. Antibiotics, also called antimicrobial drugs, work by inhibiting the bacteria's ability to produce proteins, or by hindering its ability to build its cell wall, which renders the bacteria harmless. But sometimes, a mutation in the gene will allow the bacteria to become immune to this. These superbugs are then able to pass down their mutated DNA, and that strain of bacteria is now immune to antibiotics. This is called antimicrobial resistance, or AMR. For example, Staphylococcus aureus, also known as staph, is a bacteria in the nose that doesn't cause any direct harm, but can cause infections like sepsis, pneumonia, and endocarditis. Currently, in the US and India, 50% of all strains of staph are resistant to the antibiotic MRSA. Staph isn't the only disease that AMR affects. AMR is also complicating the battle against tuberculosis, malaria, and HIV, which makes them harder to treat. Antimicrobial resistance is not only a problem in the medical field, it is affecting the agricultural industry as well. Livestock are often given doses of antibiotics in order to prevent sickness and increase the rate of growth. The overuse of such antibiotics in raising livestock causes some bacteria to become resistant, which not only threatens the effectiveness of the medicine, but also puts the humans and the animals at risk. In the United States alone, 2 million people are infected with antibiotic-resistant bacteria, and 23,000 deaths are a direct cause of these infections. As time goes on, these numbers will only increase. There are steps being taken to deal with AMR, and currently there are many programs in place that hope to closely monitor and reduce the effects of antimicrobial resistance. The Global Antimicrobial Resistance Surveillance System, also known as GLASS, provides surveillance of regions for AMR and collects and analyzes the data. This international sharing of data allows for a more targeted approach in fighting AMR. The World Health Organization, along with the heads of state in the United Nations General Assembly, established a Global Preparedness Monitoring Board, GPMB, which met for the first time in September of 2018. The goal of the GPMB is to help all countries reach a certain level of health preparedness and serve as a platform for communication. This is a prevention method for future epidemics and pandemics. Health preparedness includes standardized healthcare infrastructures, research capacity and facilities, access to new drugs and treatment methods, and education programs for the general public. However, the World Health Organization is unable to make programs like the GPMB or GLASS mandatory, as that would violate national sovereignty. Because not every country is at the same level of health preparedness or is as economically able as countries like the United States and Canada, the World Health Organization urges all countries to join the programs and work together in the face of this impending crisis, as antimicrobial resistance affects everyone. Because of how new the Global Preparedness Monitoring Board is, there are many undetermined factors, like what is the GPMB able to do? How is it going to receive the funding needed to kickstart all these programs? These are the questions that are being asked and discussed right now in the UN. Antimicrobial resistance is an increasingly urgent issue that needs to be addressed before an outbreak of an antibiotic-resistant bacteria occurs.